Introduction. A variety of diseases could present as a lump or mass in the neck. These could be inflammatory, congenital or neoplastic lesions. Whenever a patient presents with a neck mass, it requires some workup, especially if a malignant neoplasm, i.e. cancer, is suspected. Basic anatomy. Workup for neck masses requires a basic understanding of the structures of the neck and at which level they lie. One way to localize the different structures is to divide the neck into a number of triangles. Another way to define location is the levels system. This system is especially useful when defining enlarged lymph nodes in the neck. Lymph node groups and their respective regions in the neck are assigned numbers from level 1 to level 7. It is important to note that lymphatic drainage from the entire head and neck goes into the neck nodes. Sometimes, diseases in the abdomen could also travel to the neck nodes. This means that if there is an infection or cancer, especially in the head region, it can easily lead to lymph node enlargement in the neck. Finally, the simplest way to define neck masses is to divide them into midline or lateral neck masses. Examination. Once the patient presents with a neck mass, the main concern for the physician is whether the mass is neoplastic, i.e. cancerous, or not. Here are some important points to note in the patient's history. What is the age of the patient? Neck mass in patients less than 35 years is unlikely to be a malignant cancer. How long has the mass been present? If it is present for more than 3 weeks, then there is a suspicion for neoplasia or tuberculosis. But if it is less than 2 weeks, then it is most likely infective lymphadenitis. Is the neck mass painful or tender? Pain and tenderness are generally features of infections or physical trauma. In contrast, neoplastic lesions may be painless. What are the associated features? Is there toothache, sore throat or odonophagia? Is there associated hoarseness, dysphagia? Weight loss, night sweats or fever? Is there any history of tobacco use? Any irradiation of the neck? Has there been any contact with pets? In the physical exam, note whether the mass is midline or lateral. Does it move with swallowing? A midline mass that moves with swallowing generally arises from the thyroid gland. Is it tender to touch? Is it warm? Is the mass soft, firm or hard? Is it mobile, or is it fixed to the underlying structures? Does it appear fluid-filled? If fluid-filled, does it transilluminate? This indicates a cyst. Can the skin over the mass be pinched, or is it firmly adherent to it? Is the mass pulsatile? Pulsatile mass usually arises from a blood vessel. If an enlarged neck node is encountered, it warrants a full examination of the head, especially mucosal surfaces, from which the lymphatic drainage reaches the neck. Hence, the face, oral cavity, tongue, teeth, lips, saliva glands, oropharynx, nasopharynx, larynx, and hypopharynx should be examined. If direct examination of these regions is not possible, then it should be done by indirect mirrors or fiber optic devices. When possible, these regions should be palpated in addition to visual inspection. Other lymph node groups should also be palpated, such as the axillary and inguinal lymph nodes, as well as checking for spleen or liver enlargement. This is because lymphoma can present with multiple enlarged lymph nodes in the neck, as well as other lymph node groups, along with hepatosplenomegaly.